moderator Wallet from Vermont was talking about how their plan was healthcare reform on steroids, or an exchange on steroids, and I would say ours is on caffeine at least. Thanks, Richard. Thanks to the Rockefeller Institute for holding this forum, and it's great to be up here on the panel and let you know a little bit about what's going on in Connecticut. Our foundation was formed in about 10 years ago. We're a conversion foundation. When Anthem bought Blue Cross Blue Shield, and Anthem went from a nonprofit to a for-profit. Our then Attorney General, now Senator Richard Blumenthal, and our then Comptroller Nancy Wyman, who is now our Lieutenant Governor, filed a lawsuit to try to hold on to some of the assets that had been built up over the years, and as a result of that, our foundation was formed. I'm going to tell you a little bit about the history of the development of Sustanet, which is the name of our public option, and then we're in the midst of the legislative session, and so daily things are changing as to where it's going to end up. The mission of our foundation is pretty much in our name, and we really began working on systemic change to healthcare reform to healthcare in earnest in 2006. So that is an important year. That was the year that both Massachusetts and Vermont did pass their legislation, and that was a year where the foundation started staffing up to increase our capacity on the advocacy front, as well as publish 2 policy papers on healthcare. One was just mapping what's happening with our healthcare system in Connecticut right now. What are the costs? What are the quality issues? What are the access issues? But the other one was called Sounding the Alarm, and it modeled 3 different approaches to getting to what then we really were thinking of as universal access. And one of them was single payer, and actually our modeler, by the way, was John Gruber, who's on the Connector Board, so there's a lot of back and forth between our states in a number of different ways. So that document you can find on our website, universalhealthcare.org, ct.org. Sounding the Alarm modeled single payer. It modeled what sort of looks like what we now call an exchange, a pool of different competing health plans, and it modeled a big expansion of the safety net. Not surprisingly, single payer ends up economically looking the best, having the most cost savings. But there's a lot of tricky aspects to implementing single payer at the state level, which I'm sure we'll be hearing about from Vermont. And those two of those options then actually went into the political arena, and the champions in Connecticut of healthcare reform have really been in the House, in the legislature. In 2006 until 2011, we had a Republican governor who still was a Connecticut Republican, which is a little different than some of the Republicans that you see now at the national level. But she was not keen on major changes in the healthcare system. And the people that really have been pushing for change in Connecticut have been in our House. Primarily the Speaker of the House, Chris Donovan, and as well as coming along in leadership on this issue has been Betsy Ritter, who's the co-chair of our Public Health Committee. In Connecticut, all our committees are House-Senate combined committees, and so there's a Senate co-chair and a House co-chair. And Betsy Ritter has been a real advocate. So in 2007, knowing that healthcare reform had passed in 2 of our sister states, and knowing that the action was all at the state level at that time, many different bills were introduced, but there was one that looked a lot like the option that the foundation had modeled on pooling and competing health plans, and there was a single payer bill. And even in Connecticut, the insurance capital of the world, that bill actually made it through a fair amount of committees. But in the end, both bills died. At that time, the state was rich. Oh, it's not like that anymore. And actually what ended up happening is a lot of extra money thrown into the safety net to buck up the safety net, mainly in terms of provider payments. But that was about it. the governor actually did create a little health plan called Charter Oak Health Plan, which has not ended up covering very many people. The foundation learned from that fight that if we were really serious about getting to universal health care, we were going to have to look at cost and quality, not just access. And that was a big aha moment for us. And so we proceeded to go back and get with our policy wonk, the main policy expert that we've used in developing our proposal has been Stan Dorn, who works at the Urban Institute, as well as John Gruber has continued to do modeling for us. And so all during 2008, we went out and talked to many different groups. What should we do to really fix the healthcare system? What would really make sense? And we want to address cost and quality, not just access. We want to do it all. And we talked to so many different people from so many different walks of life. And the end result was we put together a policy brief. It was called Sustanet. That word comes from our state motto, to sustain. It's to sustain. It's sustaining gains is one of the Institute of Medicine principles when you're looking at universal health care. And in 2009, again with the Speaker of the House being the legislative champion, a bill was written and wended its way through 40 million committees. And at the same time, now the state was no longer rich, and Barack Obama had been elected, and now it looked like there was going to be federal health care reform after all. So there were a lot of things going on in the environment. In the end, a piece of legislation was passed. It wasn't quite the original, what had been in the original policy brief, but it had a lot of the features, and Governor Rell vetoed the bill in May of 2009. But in July of 2009, quite miraculously, her veto was overridden. And in Connecticut, technically there were veto-proof Democratic majorities in both houses. In practice, it's very rare for the Senate to override a gubernatorial veto. So to move Sustanet forward, a board was set up. They were given, and it was all more of a board of expertise rather than a board of stakeholders. They were given instructions to put a plan together. Oh, I'm going to blow away. Yeah. And you all, maybe if you picked up the handout, I can go briefly through what this looked like. So basically, Connecticut had been working all along on a large public option before the word had ever really been invented. And while the national debate was going on and our Senator Lieberman was fighting against the public option, inside our state, there was a big push to get a public option. And so this handout is kind of a picture of it. At the top, you have to think of an umbrella of it originally was conceived of being a large healthcare plan, a very large healthcare plan that would include the state employee health plan and would include Medicaid, the health plan, the health insurance that the state is already paying for, and then using that strength in numbers, a public option would also be created. And the umbrella that goes across the top is that everyone in this very large health plan would be getting health care in a very different way than our system looks now. And at the time these things came out, a lot of these terms like patient-centered medical home, people had actually barely heard of it. Now I assume most people in this room have heard of it. Electronic health records, this was before the stimulus package passed, and there was a lot of funding put into that. Really looking at evidence-based medicine, focusing on health equity, having a benefit structure that actually helps support people with chronic illness and emphasizes prevention. All of these delivery system reforms were going to be embraced by this very large health plan, and all the members of this health plan were going to get care in a different way. And then you can see the three cylinders. There are different populations that would be in this health plan. The state employees, they have their benefits collectively bargained. We still do believe in collective bargaining in Connecticut. And so their benefits packages would look a little bit different. And the public option, which is on the right, the nonprofit public option, would have benefits that might not be quite as rich as the state employee plan, but would look like large employer insurance, good, solid benefits. Not, we used to say we're not going to support a crappy plan. That was the technical term. So, the board met in public and had many different committees. About 160 people participated on those committees. It was a very open process. You can go to ct.gov/sustanet and look at all the reports that were produced by the different committees that looked at prevention, looked at quality, looked at health equity, many different things. And they came up with a report that just came out in January 2011. Meanwhile, lo and behold, we have a new governor in our state who ran supporting health care reform, but his number one job was to fix the state budget, which is hardly in deficit. And so we've gone into a new period of trying to figure out, well, here's the report, what's the legislation going to look like? There is a House Bill 6305, and right now there's heavy-duty negotiations going on to figure out ultimately what this will look like. I think it's quite likely that instead of having one big health plan that all these different pieces are in, we will have actually the governor's sustained healthcare cabinet, that this change is going to be run from inside the government, not by a quasi-public, which is a big change, but that many of these delivery system reforms are actually starting to move forward anyway. The governor and the state employees just settled their contract on Friday, and there's a lot of healthcare reform in that contract. We'll see if it hopefully will be ratified. And the big fight has been about, well, the public option, because now with the exchange, the public option would have to compete within the exchange. That's how the public option became conceived. And there was a lot of different press reports, but right now what it looks like is that the planning for the public option will still go forward. You have to figure out if it's even feasible. Will it really work? Can you get enough members in it to compete in the marketplace? You have to actually do really hard number crunching to figure out how this will work. But we're hopeful that within the next 3 weeks before the end of the session, not only will Connecticut pass health exchange bill, which we have 3 right now. They're busy trying to figure out how to combine them into one. And we may actually end up with one big health care reform bill that will have the health insurance exchange, will have sustanet in it too, the creation of the governor's health care reform cabinet, and we'll move all of this forward. So we'll see. Stay tuned, because there are still 3 weeks left in the session. Thank you.